Thank you, Mr Betts, and it's a pleasure to serve under your chairmanship, and it's good to see the Minister here, and thank you very much indeed for attending. Mr Betts, this debate is an important one for the island, and I'll give the Minister an example just from yesterday over what I mean. By coincidence, a friend of a friend was in St Mary's A&E yesterday. That person went in on a doctor's recommendation, and they were quickly seen and assessed initially, which was great, within 15 minutes. And they then sat there for nearly 10 hours with a cannula sticking out of their arm, with urgent on their paperwork, and 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, they left at 10 p.m. They were there for nearly 10 hours. That is not a criticism of NHS staff, quite the opposite. I have friends and acquaintances who work at St Mary's and who work in the NHS on the Isle of Wight, and I know their dedication, and I know their professionalism, and I'm very, very grateful for it. It's not a criticism either of the leadership at the Trust under our new Chief Executive, Maggie Oldham, and I'm a big fan of her leadership and her team as well, who are doing good work, and we need that leadership on the island, and frankly, we've lacked it in recent years. This is a specific issue. What I wish to discuss today with the Minister is a specific issue about the way that the NHS is funded, its funding system, and how that relates to the Isle of Wight, because it is an island. And the broader context of this debate is over my proposal for an island deal that recognises the additional costs, not massive, but the sometimes small, sometimes larger costs of providing levels of providing good levels of public services on the island which are equivalent to the mainland. I've had several conversations, Mr Betts, with the Prime Minister about my proposals for an island deal, and I'm delighted that he's agreed in principle. Most recently, he spoke about this on the House on the 25th of September when he talked of the island deal that we are going to do. I assure him that we are, do not worry. And I'm delighted with that. So this is not a case of either asking for something by way of thinking that we deserve it because we think our need is greater. It's an it's a case based specifically on the fact that the Isle of Wight is an island and it suffers from economies of scale and distortions in the market by dint of being an island. The additional costs of providing public services on islands with their limited markets, with fewer economies of scale, have long been recognised, and if the Minister wishes, I can send an extensive list of academic research into this subject, most recently done for the Isle of Wight by the University of Portsmouth. Now, in Scotland, the Scottish Islands have the Scottish Islands Needs Allowance, which very specifically gives additional funding, that's £6 million per Scottish island, to recognise the additional costs and the additional challenges of providing public services on isolated island communities. We have no such equivalent in England, and because of that, we have been structurally underfunded for generations. Now, it doesn't matter whether it's a Labour government or a Conservative government, because it is the way that the formula is designed. And I wish just to look briefly at the three key aspects of this. As part of the wider deal, the island deal that I'm discussing with the Prime Minister, there are probably 5 or 6 different elements to that potential settlement. But today, I'm just looking specifically, if I may, at healthcare costs. In July, the Secretary of State for Health in the House said, on island, as in the Isle of Wight, healthcare costs, the Isle of Wight is unique in terms of health geography, and there are places in this country, probably including the island, almost certainly, where healthcare costs are increased. And he was saying by dint not only of isolation, but also, in the Isle of Wight's case, by dint of being an island. The island's NHS Trust, in its 2019 sustainability plan, has estimated the costs in the following way, and I'll just list those costs, discuss them in slightly greater detail, and then potentially put some questions to the Minister. I know the Minister will want a decent amount of time to reply, so I won't speak for more than another 10 or 15 minutes maximum, so I can make sure I'm here to listen as well. The additional cost of providing acute services in 24-hour, 7-day-a-week wards, we estimate to be £8.9 million. The additional cost of providing ambulance services, which includes Coast Guard helicopter ambulance, we assess to be £1.5 million. and the cost for patient travel by ferry we assess at 500,000, although I suspect it might be slightly more, and I'll come to reasons why in a second. How do we get to these figures? Well, these figures come from the need to provide a baseline service by law, but to do so where there is a smaller population than average for the size of a district general hospital. So as the island's NHS Trust states, the island's population is around half of that normally needed to sustain a traditional district general hospital. Because of that smaller population, we do not have the throughput of people. So to explain it to a layman, we generate less tariffs. We have less people going through our hospital, so we claim less money for those procedures. But we still need to keep those wards open to a decent baseline standard, which is what people would expect. Now, it still stuns me that I have to explain this. A friend of mine who's a Secretary of State, a person I hold in high regard, I was having a conversation this summer about the island, and the Secretary of State turned around to me and said, yes, the island, you have to get to it by ferry, don't you? And it is not, the Isle of Wight is not an island like the Isle of Sheppey or Anglesey, in the sense that it's connected to the mainland and it's an island in some sort of quaint medieval cultural way. We are an island in a very practical way, that we are separated from the mainland. We lack a fixed link, which would cost between 2 and 3 billion. If the government ever wishes to discuss that, I'm delighted to do so. But until such time as we will have a fixed link, we are separated by water. And that means that we are primarily, almost exclusively, you travel to the island by ferry. And that changes the dynamics of the hospital, of our economy, in many different ways. Looking at the A&E, for example, we need to run the accident and emergency 24 hours a day, 7 days a week. Same with maternity. You can't give birth on a ferry. You can't give birth on a helicopter. The helicopters don't run in all weathers, and the ferries don't run overnight. We have a baseline legal requirement to have a hospital on the Isle of Wight, but we do so with half the population of a district general hospital. That means that everything costs more because we don't have the tariff per head throughput. So, for example, A&E, 7 days a week, but our income is based on a national tariff for a much larger population. We must have a special care baby unit as part of the maternity unit cover. I'm delighted to say that a lot of the time that special care baby unit has no babies in it because they're healthy births, which is wonderful. But we still need to run a 4-cot maternity unit, a special care baby unit, which costs quite a lot of money, even when it's empty, because we have half the population. The same applies to other wards, dementia ward, and again in intensive care. For all these units, for all these wards, we have to provide a baseline of service, but we do so with significantly less income coming from NHS England because we don't have the tariff. And that means that it costs more to provide a same standard of service. And that is why historically we have been underfunded for many years. And this impacts on the quality of the service that we can offer. So, for example, we're meant to have 8 consultants in our A&E. We have 4. And that is why people wait 10 hours rather than 2, as happened just yesterday. Second, it costs more to attract permanent staff due to isolation because of the island factor. So we tend to spend more on agencies and specialist services. Our use of agency and locum staff, frankly, is bad. We need to find solutions to it, and we're having to do that. But to get a locum to come to the island, we may have to offer to pay the ferry fare because our ferries are probably the most expensive per mile on the planet. And this also has a knock-on effect, the use of locums, temporary staff, on training for training for our young doctors and nurses. So the General Medical Council found issues with foundation training due to inconsistent levels of supervision, up to and including earlier this year. So that's the first point to the acute services. I'm going to speed up a little bit because I want to get as much in as possible. Second, our ambulance service has suffered too. Why? Because we can't use an overlay of ambulance. If you're taken ill and need an ambulance and you're on the Hampshire and Sussex border, if there's not a Hampshire ambulance willing to take you, you can pretty much guarantee there'll be a Sussex ambulance along. We can't have that. We don't have that on the island because it will take an hour and a bit for a Hampshire ambulance to get on the ferry to come over. So we can't call on out-of-area ambulance services from Sussex or Hampshire or Dorset or Cornwall to support us. So in busy times, or when we're taking folks to the mainland, there are significant the additional costs of overtime and manning costs stack up very quickly as soon as there's a slight level of pressure on our ambulance service. And we estimate that cost to be £1.5 million. Again, I'm very happy to discuss that, along with the 8.9 million and the £500,000 for patient travel. Again, this is not being based on being poor and earning a bit less than the national average. These are specific costs associated with islands. Finally, patient travel. In 2017-2018, there were 31,314 episodes of planned care, sorry for the bureaucratic terminology, on the mainland related to Isle of Wight patients, which translates to 44,608 related journeys from the Isle of Wight to the mainland. Now, our plan to improve quality of care on the Isle of Wight, use of telemedicine, better integrated IT, we hope to reduce that amount of travel to the mainland. But I believe that the NHS England should be funding some of that patient travel. At the moment, the council funds £60,000 worth of chemotherapy visits, and the ferries also subsidise, to their credit, others. I want the ferries to spend that subsidy money on other things, and I want the NHS England to pay for this. And I look at the Scilly Isles as an example. The National Health Service Travel Expenses and Remission of Charges Regulations 2003 sets out that any Scilly Isles resident not entitled to free NHS travel will pay a maximum of £5 for their travel costs. Now, I would ask for that £5 maximum return fare to be funded as part of this Isle of Wight settlement. And the cost for NHS England to take on patient travel, such as chemotherapy and for other specialist services to the mainland, is estimated at approximately £500,000 per annum, maybe a little bit more, it depends on how one calculates. I would like NHS England to fund that. It would also add as a spur to improve integration of IT, telemedicine as well, because the island wants to become a model. And I'm delighted that we got the £48 million from the Department of Health recently. Thank you very much indeed. A fantastic bid put in by Maggie and her team, which I was delighted to support and meet with ministers about. Some of that money is for our A&E to improve that, and some of that money is for telemedicine. And I've seen and I've met with some of the guys who are doing and girls who are doing the telemedicine work. We have 42 nursing homes on the island, and I think in 18 we have this little blue box now, and residents in the nursing home can have their vital statistics checked on an almost daily basis, and it saves money and time, and it means that their information gets sent every morning to the GP or to the district nurse so they can be checked up, and it's much more proactive. And this is the future, and it is really good and very exciting, and we want to be in the forefront of that, and it would make not only ethical sense, not only medical sense, but also economic sense for us to do that, because then there'll be fewer trips to the mainland, fewer costs, in fact, fewer trips to St Mary's and even fewer trips to GP surgeries. So those are the three areas that I'm focusing on. The cost of acute services, 8.9, cost of ambulance, 1.5, including Coast Guard Air Ambulance, and the cost of patient travel. And I want to stress this is not related to wider problems. You know, we have problems with deprivation on the island, which sometimes surprise people. In Newport and Ryde, they're amongst the 10% most deprived areas in England. Our disease prevalence is higher than the national average significantly for dementia, for stroke, for learning disabilities, arthritis, and some cancers. I'm not making a case for additional funding for those things yet, because actually the priority is for the government to recognise that there are additional costs in providing healthcare on the Isle of Wight. We are doing our own thing. And I wish to stress to the Minister that we are not covering up for a poor quality NHS trust. It is in special measures. We've got new leadership. We are turning it around. We are going in the right direction. And I pay tribute to the leadership of the NHS team on the island again. We know we need to do more to improve our productivity. We've got 149 nurse vacancies earlier this year. By the new year, we expect that to be under 90 by getting Filipino nurses in for sure, but also training up islanders as well and making sure that we're giving islanders jobs as nurses as well. We have new models of care, especially mental health services and acute, which have been too, I think the word is paternalistic in the past. And we are significantly improving those fields, especially mental health, which has still seemed to be inadequate and failing. And we're sharing consultants more. And this is the way ahead. We cannot afford specialists on the island with our size. but working with Southampton, or more likely with Portsmouth, we can afford to share those specialists. And either we're about to, or we just have, or I think actually just about to, sign a memorandum of understanding with Portsmouth, so that we make greater use of efficiency, so that we share consultants, so we share specialisms and specialists. So when they're not working in Portsmouth, they can jump on the ferry and they can come over to St Mary's or where they're needed on the island and support us there. There have been recent failings, as we know, which is why we're in special measures on the island. And some recent episodes that concern me include lack of discharge summaries. So patients are leaving hospital without a discharge summary. And too often that's been happening, and that was raised in a coroner's court recently, and that's not good practice. I can't make things in the past right, but what I can do is do my utmost to make sure that they don't happen in future. And that is effectively what I'm trying to do in my role as a Member of Parliament for the island, is to be a critical friend to Maggie and her team, to identify where I'm hearing complaints from my islanders, my fellow islanders, about certain things. I will pass that on in the hope that she can then focus on that, whilst at the same time understanding the importance of supporting the new leadership team. But what I ask in return from that team is honesty, to make sure that we are transparent about any past failings and current failings, not in order to blame and to have a go at people, but actually in order to collectively work how we can raise our standards to give islanders the quality of healthcare that frankly we deserve and that I want to see for the island. And until that time, what we've got at the moment is not good enough, because government has never taken into account those additional costs of being an island. So I say overall things are getting better. I'm delighted about the 48 million. I've discussed telemedicine and IT. I won't go over those again. Just in the last 2 minutes, summing up, special circumstances, severance by sea, hence the need for an island deal, which encompasses a range of issues, which I've discussed with the Prime Minister. In this debate now, Mr. Betts, I'm looking specifically at healthcare. So 3 areas: acute, 8.9 million; ambulance, including Coast Guard helicopter, 1.5 million, and the cost of patient travel to be £500,000. Those are what we, I think accurately and honestly, assess to be the additional costs. I'm hugely grateful for the Minister for being here. I hope she's not missing conference on my account, or maybe she's very happy she is, I'm not quite sure nowadays. My questions finally to her: will NHS England be accepting our costings for the additional cost of providing services on an island, and specifically the Isle of Wight, due to having to have baseline services with fewer people coming through and therefore less funding? Or will NHS England be providing their own costings? And if NHS England is going to be providing its own costings, on what basis will those costings be? I'd like to know if NHS England disputes our figures and when we can expect official comment. I'm not trying to bounce the Minister into a decision today, as well she knows. The most important thing is that we get a considered response, and this conversation now begins so that I can deliver what I need to deliver for my people. Can the Minister please outline for the public record, or write to me if need be, outline a route by which the island and NHS England can work together to identify additional costs of providing healthcare on the island and look at a time frame for decision making? And finally, where does the Minister feel that these additional healthcare pressures figure in overall funding for the island? And I ask that not only because, as I say, we've got costs associated with being an island, but we have additional costs associated by being slightly more deprived in some areas than others. So we have high dementia rates on the island, we have higher cancer rates on the island, we have higher arthritis rates on the island as well. So not only are we dealing with some acute and chronic cases that are higher than the national average, but we're also dealing with the island factor as well. I thank the Minister very much for your time. Mr. Betts, thank you so much indeed.
Thank you, Mr. Betts. It's a pleasure to serve under your chairmanship. Firstly, I would like to thank my honourable friend, the member for the Isle of Wight, for bringing forward this important debate. And I recognise your support for the Trust, your desire with others to improve services, but the fact that you very much today want to highlight on those 3 specific things. We recognise that the Isle of Wight faces different challenges compared to the mainland. As you said yourself, it represents a very distinct healthcare environment, whilst also being closely dependent on acute services close by, but with the difficulty of travelling across water and the challenges that that accessibility brings to you. I know that the local Sustainability and Transformation Partnership are considering how to put healthcare on the Isle of Wight and in Hampshire onto a sustainable footing with the high quality that you've been asking for, and in the interest of the system as a whole and for the long term. Now, the impacts these challenges have on local NHS systems needs to be something of a discussion. I want to reassure my honourable friend that we are committed to providing that high quality care that you seek to meet the needs of your people across the island and accommodating people irrespective of where they live. Now, it's important that we don't let the NHS stand still, and you alluded to telemedicine and making use of all these future technologies. We know people are living longer, and that, in point of fact, on the island you have a higher than national average elderly population, and that elderly population living with multiple comorbidities actually puts a higher pressure on the service, as you said. But you also spoke of how you're beginning to address those challenges, using blue boxes, using the whole system to help the entire system work better. The long-term plan sets out how we will provide high-quality healthcare for all and ensure that people live longer, healthier and more independent lives, which is what we all want. The plan recognises that the NHS needs to change and implement new systems to meet the 21st century challenges. So actually, we're at a point of opportunity. We are committed to delivering high-quality universal care, irrespective of the location, and as I said, particularly important with the challenges that you've outlined that the island life brings you. You know you have benefits of being on an island, but actually some of the constraints are what we've now got to sit and work through with you. We accept that there are additional costs to providing healthcare on the island. It has individual challenges arising from delivering care on the island with the diseconomies of scale that you spoke of so well. Earlier this year, we committed 2.7 million extra funding committed for the Isle of Wight under the Fairer Funding Review to help start to work through some of this. This is to support the CCG and the NHS Trust and the local council's plan for integration of public services, which will improve the care that patients receive. But I very much hear what my honourable friend is saying about how we work together to find solutions for the long term. The island will also benefit, as you said, from the announcement of the 20 hospital upgrades, and I am grateful that he mentioned the 48 million for the Isle of Wight. This extra investment will see improvements in the patient care and hopefully will allow flexibility for Maggie Oldham, the Trust Chair, and the team in order to progress their ideas further and allow the island to better utilise innovative technology, improve efficiency, and that quality of care that you've highlighted is your key objective. I want to pay tribute to the work of all those that have been involved with the Trust in order to actually, given the difficult circumstances it faced when it had a rating from the CQC of inadequate, of how it's begun that positive journey to make things better. There's welcome recognition that I would like to give for the hard work that everybody has put in across the health and social care system in the area, and it's a really, really positive start. We will now look at the local system supported by NHS England and NHS Improvement to protect and build on those achievements. And I've already spoken to the Minister for Hospitals, my honourable friend, the member for Charnwood, and he is more than happy to meet with you, with his officials, so that some of those specific questions can be given the proper, appropriate attention in order to work through. You wouldn't expect me to be giving you specific answers to those here today. But moving forward, in the medium term, it's vital that the island develops a strong joined-up plan across its health and care system to deliver your vision of a person-centred, coordinated health and social care that gives patients the support they need. It's a very unique system that cares for you from birth to the end of life. And those things need to be looked at specifically. And you've highlighted your challenges around the ambulance service not being able to cross over and lay over as many of the rest of us on the mainland can do more easily. Patient travel costs in particular, I have heard his request. I have been assured by my honourable friend that NHS England and NHS Improvement have been involved in the development of plans and will continue to work very closely with colleagues on the Isle of Wight. So I hope my honourable friend realises that we are all here to support both him but also the broader health system on the Isle of Wight to develop in the way it wants to. While I recognise the concern of members of this House representing island constituencies, I hope you're reassured by the ongoing work that we are doing to ensure appropriate resources are available in the NHS on the Isle of Wight and on similar islands to support patients meet CCG's obligations, as you laid out, to commission the best possible care. The Government's committed to ensuring all patients, irrespective of where they live, receive high-quality healthcare that meets their needs. And I very much look forward to whether it's myself or whether it's the Minister for Hospitals continuing this constructive dialogue.